With all the wildfires currently burning in our state, it's easy to see and smell the impact they're having. Within the last week, the Forest Service announced firefighters are now allowed to use N95 respirators on the fire line. Previously, that wasn't allowed. It's seen as a big step in acknowledging the health risks associated with wildfire smoke. Here to talk about those risks is 9 News health expert Dr. Kohli. Thanks for coming in.
Good morning.
This is top of mind for a lot of people.
Yes.
So what makes the smoke different than like normal pollution?
It is so much worse, Corey, than normal air pollution. In fact, it has many more toxins. So wildfire smoke has about 10 times as many toxins as regular air pollution. And sometimes they say some of the fires can have over 400 different types of toxins that can affect our health. They're smaller particles. Now that may seem better, but it's actually worse because these smaller particles can travel deep into our lungs and actually dissolve into our bloodstream. So it's called particulate matter. And they're 2.5 microns, which is less than a third of a human hair. So these tiny little particles you can't see, but certainly you're inhaling them. And they're more toxic particles. So when they interact with the air, they actually undergo processes and make more free radicals that are more damaging. And believe it or not, wildfire smoke can travel hundreds to thousands of miles.
Really?
They've reported actually wildfires on the East Coast traveling all the way to Europe, and of course definitely across America. So putting all that together makes it really concerning, and certainly I've been feeling the effects of them myself.
Which is my next question, because you're healthy. If someone's like, I'm a healthy adult, this doesn't affect me, is that true?
Not true.
Okay.
And so it affects every single one of us. Now, of course, the people there are more people at risk, and those are the older people because they have less lung reserve, are kids. So kids that are exposed to pollution, at least for 5 days, have a significantly higher risk of developing asthma.
Really?
Because their lungs are still developing. So when they start to see this wildfire smoke, especially if it happens, and you can imagine over the course of a kid's 16 years while their lungs are developing, they may see more than a single day of wildfire smoke. 5 days will increase their risk of asthma. I think about my pregnant patients because that's toxic, not just to mom, but to baby, and it crosses into the placenta to baby, and then anyone with lung disease or heart disease. But even for healthy people, and even a smoky day here or there can have significant short-term impacts.
This makes me wonder, like right now, kids are out on summer break, they're all playing outside, they're at camps. I know my kids are probably at the playground as we speak. Should they not be outside right now?
They should not be outside right now. I mean, definitely not be outside right now. And Katie will tell you when it's, red or orange, and those are orange for sensitive groups for sure, but red really for everyone. So for kids, orange and red means no outdoor play. As much as I hate to say that over the summer, but it's really important because it's a dose problem here. And so the dose of smoke and for how long. And so we've had both high doses and many days now of these wildfires. I was up in the mountains over the weekend and I certainly felt it.
Yeah.
I mean, my eyes, my throat, I just felt awful.
How do you know if it is affecting your health?
So the earliest signs are kind of your mucous membranes, the portals where it gets into. So your eyes get kind of tingly, you can have a little bit of throat irritation, you can have wheezing, you can have some shortness of breath. But you really want to be careful because it can very quickly cross over into carbon monoxide poisoning, and you may not realize it. So a little headache is okay, but if you start feeling dizzy, if you have severe chest pain, if you have palpitations, or any other symptoms that seem very concerning, you may actually want to go to urgent care or see your doctor to get it checked out.
I think we naturally think of our lungs, but like as a cardiologist, this can affect the heart as well?
Yes, I've had an influx of patients. And so what wildfire smoke does is changes our hemodynamics. It increases our heart rate, it increases our blood pressure, and that's just for healthy people. When you talk about heart patients, it can actually increase the risk of heart attacks and strokes because it triggers inflammation. It also triggers blood clots inside the arteries because I told you that particulate matter dissolves into the bloodstream. So I've really got my radar up because, immune suppression, lung effects, heart effects, even dementia. And we even know that firefighters actually have a lower life expectancy. And I'm so happy about this N95 thing.
It's huge.
Because it's a big deal and it can affect all of our life expectancies.
You were talking about 5 days for kids can trigger asthma. Prolonged exposure, obviously, to smoke, big deal. But can you have problems after just 1 day?
You can.
Okay.
You can. And they can be short-term, but also long-term, depending on your underlying susceptibility, depending on how much smoke you were exposed to and really how many toxins were in that. So I would say these days, again, as much as I hate to say it, no exercising outdoors, because any exercising means you're taking a bigger dose of air. I worry about our outdoor workers, like our construction workers, and I hope that some of them can actually wear some of those N95 masks as they're working outside. But certainly I'm going to be listening to Katie every day to see what the air quality index indexes. I checked it this morning as well, just to know how to plan my day and how much time to spend outside.
Aside from the wildfire smoke, I got to ask you about this because so much of the country is under a heat dome right now, right?
Yes.
I mean, in Europe, they've had thousands of people die from heat exhaustion, right? And on the East Coast, we're talking about 100+ degree temps for quite a while. What signs do we need to watch out for that where it could be really like possibly dangerous or deadly?
Yes, so certainly in the early phases, your body raises the heart rate to try to give off heat. So think about our sweat glands, like the AC turns on the AC to try to cool us down. So you'll initially feel kind of a fast heart rate. You can maybe feel a little nauseous or queasy. Kids can complain of being tired or having a tummy ache. These are all signs that they're starting to develop heat-related illness. But in the later stages, the body gives up, and you can actually have the opposite effects where you have cold, clammy skin, you're not responsive, you can even be comatose. So for older patients, I really do advise using the air conditioning generously during these times, because the combination of the wildfire smoke and the heat can trigger cardiac arrhythmias or electrical problems as well. So, but also watch out for kids, because they may not be able to verbalize what they're feeling.
Each one individually is so dangerous and deadly, and then you combine them
together.
There's so much happening right now.
Yeah.
Dr. Kohli, thank you so much. Let's get over to Katie right now. Even us, we're dealing with upper 90s for a long stretch.
Absolutely. So heat, and of course, Dr. Kohli, thank you for that really important information.